Hello, and welcome to this 7-minute briefing podcast. Today, the topic is information sharing between Pen and Care NHS Foundation staff and other professionals. My name is Darren Lawton-Edge, and I'm the named professional for safeguarding adults for the Trust. So I'm just going to talk through this 7-minute briefing. So a consistent learning theme arises from serious case reviews that this encompasses child safeguarding practice reviews, safeguard adult reviews, learning reviews, and domestic homicide reviews. It has been identified that a lack of information sharing across services, which also includes the LEDA reviews. So what about some myths? Well, it's a myth busting that personal information collected by one organisation cannot be disclosed to another, as health and social care organisations are legally obliged to share information with each other in cases of child, young person, or adult at risk of harm. Working together with Safeguarding Children's Act 2015-18 and the new one in 2023, and the Care Act 2014 encourages information sharing between professionals and as not to do so where a risk of harm is evident and it impacts on the safety for patients and individuals who use Pen and Care services. So why is information sharing matter? Well, effective information sharing allows for continuity of risk management and care planning, a more thorough formulation of service users and their needs, a timely follow-up from services, an improved consistency for service users, and a reduction in confused, conflict, and unnecessary distress to service users and their carers. And it improves confidence in services, and it ensures the right services get the necessary information they require. We have to also remember the 7 golden rules of sharing information from the Data Protection Act 2018 or GDPR and human rights law are not a barrier to information share. We need to be open and honest about why, what, and how we're going to share the information or how it could be shared. Seek advice in a doubt about information you are sharing. We've got a fantastic information governance team. Gain consent wherever possible, where appropriate. You may still share information without consent if the lack of consent can be overridden in the public interest or to prevent risk of actual harm. And we need to justify this on our record keeping. Consider safety and well-being. Ensure information shared is accurate and up-to-date, necessary, appropriate, secure, timely, and proportionate. Record the reason for sharing information or omitting to share information. An example of this will be doing a safeguarding alert. You can do a safeguarding alert to the local authority. For example, if you're making a safeguarding alert to Oldham local authority, you fill in the form, and you have to remember to include what is the type of abuse you're reporting, and give a brief synopsis of the concern. What you don't do then is attach someone's risk assessment, care plan, mental health assessment, because you are sharing too much information at that moment in time, so it's not proportionate. But examples of when to share information when without consent. So an adult is at risk of experiencing significant harm. Other people or public could be at risk. People lack mental capacity to make decision and harm is identified and you have recorded the mental capacity assessment. The person has the mental capacity to make a decision but is experiencing duress or coercion. Remember to record your decision making. Prevention of a crime. A serious crime has been committed. The alleged abuser has care and support needs and may also be at risk. So who should we share information with? Well, sharing between health and social care services may include various professionals. We can share information legally without consent and lawfully. If it's to keep a child or individual at risk safe from neglect or physical, emotional, or psychological harm, or if protecting their physical, mental, and emotional well-being. Examples of good information sharing for staff include copying correspondence at the point of assessment, admission, or discharge to GP, maternity, midwifery. Health visitors where there's a child under 5 at home, school nurses when working with school-aged children, looked after children, which are called LAC nurses, when working with this group of children, social workers whenever they are involved, probation if there is a significant risk or relevant, and maybe also the safeguarding team. So this briefing has been updated to reflect the GDPR and Data Protection Act 2018. And you can contact the safeguarding team Monday to Friday, 9 till 5 on 0161 716 3785 for further advice. And we do a duty service from 9 till 4:30 each day. Thank you for listening.